Losing weight doesn't have to be an issue anymore. Take a comprehensive weight loss program approach with Southern Nevada Bariatrics.
That's right. Here to explain all of your options is bariatric surgeon from Southern Nevada Bariatrics. This is Dr. Mustafa Ahmed. How are you, my friend?
Hi, nice to meet you.
Welcome.
So what ended up inspiring you? Because you've been a doctor for many years now, but you in the past 5 years or so, you got into this. What inspired you to get into the bariatric procedure?
Well, after medical school, I started becoming an internal medicine doctor.
Yeah.
I trained as an internal medicine doctor, and in my practice, I had a very large practice, and the most common diseases were diabetes, high blood pressure, coronary artery disease, sleep apnea, people who've had back pain, neck pains, knee pains, and the common thing with all these patients was the fact that they were overweight.
Yes.
They were morbidly obese.
That was the thing that was causing it.
Exactly.
Yeah.
I would have the patients take insulin and try to get them to lose weight, but it was hard. They'd keep coming back and we'd keep going up on it. And so one of the things that really inspired me to go into surgery was bariatric surgery, because I said to myself that the root cause of all these problems is weight. And it has been shown, studies have shown that no matter what you do, the only really long-term way of losing weight is through surgery. Yeah. And you can do all the weight loss, medical weight loss that you want to do, but the weight comes back. You try medicines, the weight comes back once you stop. So all these things don't really help. So the root cause is being overweight, and surgery is really the way to go. And that's what really inspired me. Now, the good thing with me is that I also train in addition to surgery in critical care. So when a patient comes to me in the office, I can look at both sides. I know the medicine, I know the surgery, I know if there's any critical care issues. I'm board certified in internal medicine, in surgery, in critical care, all three, which is very uncommon. And I spent 10 years in training doing both 2 residencies and 2 fellowships. Wow. So really, when they come to me, it's a comprehensive approach of treatment. So I don't just look and say, okay, I'm a surgeon, all I'm going to do is cut and then you go. No, I take care of them, and those patients are with me for the rest of their lives.
That's awesome.
And I take care of them. And also, in addition, we have hormonal therapy that we also do in the practice. And also, so that means that after they have the surgery, then we start this comprehensive program of making sure that all their vitamins are, that they're taking all their vitamins, their levels are good, their hormonal, their testosterone levels are within normal limits. If they're not, then we treat that, because we found out that as patients age, your testosterone level for both men and women drop. And that causes you to gain weight, and that causes you to not be able to sleep and not function properly. So we have a comprehensive approach, whereas other bariatric surgeons don't. So that's really important for me.
And Dr. Ahmed, addressing these other issues is very important, because that's part of the danger of obesity, isn't it? That the other health implications that come along with it?
Absolutely, absolutely. As you gain weight, you have what's called insulin resistance. And when you develop insulin resistance, then you need to have more medications in order to put that glucose or sugar into the cell. And so as a result, you start to develop what's called the metabolic syndrome, which is high cholesterol, coronary artery disease, diabetes. You also start to develop, I have patients who have knee pains, back pains, and sleep apnea is a big thing. Now, if sleep apnea can cause you to have a heart attack, and it can cause you to have cardiomyopathy, which
frankly,
means
while you're asleep, it's almost as though your body's trying to kill you.
Exactly. And so what happens with sleep apnea is patients cannot get into the 4th stage of sleep, which is the REM sleep. And as a result, all day long, you're foggy and tired. And so what's the root cause? The root cause is being overweight. So you've got to treat the overweight.
It's really a vicious cycle.
It's a vicious cycle, And patients who lose the weight tend to live much longer, have a much healthier life, have a much better quality of life. And so so my goal really is to make sure that patients have good quality of life, and so that's the way to go, is both comprehensive approach.
We got about 45 seconds left. I want to make sure people that they might be watching, they want to see what their options are. How do they get the ball rolling? How do they get in contact?
Well, we have a seminar, so they can call SouthernNevadaBariatrics.com is our website, and then we also have our phone number, which hopefully will be on there. So what we have, so each person is different. So I look at each person as separate. So there is no formula for everybody.
No one size fits all.
No one size fits all. So some people will have just maybe medical weight management. Maybe some people will have sleeve gastrectomy, and some will have gastric bypass.
It's great, Dr. Ahmed. You're able to cater it to each person individually. Thank
Absolutely,
you so much.
and that is the important thing.
Exactly.
I really care about the patients, and so that's how I approach comprehensive. And I'm personable. My practice is not a
you
not
are
a factory.
you are
Passionate about
personable. This is a great guy.
It's great having you, Doc.
Thank you so much. Attend a free seminar in a group or one-on-one setting. Your choice, folks. You can help figure out what your best option is. Visit Southern Nevada Bariatrics today on Eastern and Desert Inn Road. For more information, call the number or visit their website. Southern Nevada Bariatrics is a proud sponsor of the Morning Blend.